140 people die every day from an opioid overdose.
And a big hot topic these days is opioid dependency. It's at a rampant rise. We have people addicted to these very, very dangerous narcotics. There's other solutions that are out there for people that, for their pain.
Prescribed analgesics to treat chronic pain turned out to be the worst solution, and nowadays they play a fundamental role in the crisis that greatly affects the public health system of the United States.
Some of these surgeries cause a lot of pain after and during the recovery, and they're given these opioids and then eventually become addicted to it. The key to these things is getting the patients off those opioids as fast as humanly possible and get them into some physical rehab at that point.
According to a report from the Centers for Disease Control and Prevention, between 21% and 29% of patients who have been prescribed opioids use them inappropriately. Dr. Brandon Hochman of MedPlus Centers assures that there is a way out of this crisis.
We see a lot of these patients get hooked post-surgical, and it's not like they're out there trying to find these opioids, that they're given it right off the bat. And then what we find is getting the patients into physical therapy as soon as possible when they're able to get up and do their thing with us, that the dependency on those opioids goes down tremendously.
For every 1 million of Americans, almost 50,000 doses of opioids are taken every day.
Chiropractic physical therapy is really on the forefront of this opioid addiction and fighting it, because it's a natural way of reducing pain in the body. If done correctly, it's extremely effective for not only the patient's health with immune system, nervous system function, but reducing pain is pretty much what we're known for.
The excess of opioid medical prescription is due in part to how difficult it is to have health insurance in our country. Many sore patients need physiotherapy, however, their insurance does not cover it. Therefore, doctors choose to prescribe opioid to relieve pain.
If you're having a physical issue, it needs some sort of physical solution. The chemical dependency of this is huge, and it's something that a lot of times can be avoided. If you look at the studies that show how much better patients do with using chiropractic in their protocol and how much less drugs they need to help get over these rough spots, it just seems like such a simple solution to try something that is way less invasive.
Dr. Hochman, who is a chiropractor with over 15 years of experience, says that the solution to the opioid crisis is physical therapy.
In the future, people are going to start looking toward chiropractic as a major cog in the reduction of their pain, for sure.
The message is clear. Better to invest in physical therapy than in drugs that can cost you your life.
We implore people that are using these types of things to get off them as soon as we can. I mean, we are not taking them off these meds. Their doctors have to take them off of it, but we are certainly ready to become a solution for these patients when they need it.